So I'd like to move on to the next panelist, Miguel Luengo-Oroz from UN Global Pulse, UN Secretary General's Big Data and Emerging Technologies Innovation Initiative. Miguel, really welcome. It's really nice to see you as well. And I'm glad you're back to work. And your team presented the other day on the radio listening project that you work on, and but I know that you think you more broadly even related to big data analytics. And I have two questions for you. One is, what do you think, to the discussion even today, how do you think we can advance digital social listening initiatives, with this need to be complementary, use data sources from different origins, to triangulate and to interpret. And I think, especially in light of also this project that you've conceptualized and are leading on radio listening, I mean, that's extremely important to better hear from vulnerable, marginalized, and remote communities, where triangulation is important, and also assessment of narratives that are being shared is really important. Do you have any thoughts? What are your thoughts regarding this and challenges and opportunities moving forward?
Thank you, Tina. I'm really happy to be in the conference and share our experience. So, I mean, I guess that as Peter and Joanne mentioned, I think, this integration of like the online and offline modalities is something that as a community, I think we really need to go deeper. Something that I think we are missing also is some sort of evaluation criteria for the reliability of the different data sources. I mean, so it's almost, it's strange. Even when we use any social listening tool, we don't know the level of false positives or false negatives that the algorithm of listening are giving to us. I mean, we really don't have control experiments, and we don't have ways to somehow put under the same framework, even if they have different time scales or different geographical scales, different data sources. So I think one potential to move forward is really to have a coherent framework that multiple data sources can be integrated and evaluated. Then there is a second step, which I think now we are barely touching, which is when we are doing analytics at scale, which is what we will be doing. I mean, either if it's with social networks, or with radio at scale, or with like surveys at scale, then we are using algorithms that has their own bias, and that sometimes might give patterns that, are just artifacts. So there is another field that we are starting to see in general, how to evaluate AI bias, how to go for like machine learners, which are like methods which are explainable, that I think those also need to be landed into the infodemic space. Also because there is a very direct question. Are we reverse engineering the inherent algorithms that the platforms are using to amplify the message? Or are we finding patterns which are more on the social construct? Okay, so for me that's like a part of what we have to do, and I agree also with what was said before, that closing the gap from getting the information, analyzing, and really actually seeing which are like the behavior change, that is critical, and we really need probably to design end-to-end experiments. Going one level down on the radio, as we said, as my colleague Joseph presented, radio 75% of the population are on radio. So I think that is an under-tapped resource. We are working on speech-text technologies, which are able to somehow create a feed of information coming from the radio. But here, there are many challenges. And this is a call for help. There are many challenges. First, because there are not language models for which allow doing speech-to-text for many languages in the world. We are talking about there are more than 7,000 languages. Less than 100 exist in the digital space, and probably less than 10 are really well, we have enough resources. So really many voices are left behind, just in this case, because we have no way to listen to them. A second which comes after this, is a call for help also for having open source technologies which allow to do this at a reasonable price. Because even if we manage to connect and do it, I mean, these resources have to be something that any information management officer and a public health institution should have. So that's like a second point. And the last one, and not least, is piloting those uses. Okay? And we hope to launch in a number of countries together with the team at WHO some pilot cases where we can see the inherent nature of radio information at scale. And here, just to maybe close the loop, and also compare it with what comes, for instance, from digital social networks. Okay, and this is one experiment really on seeing how you can use that information, but also how the trajectories over media, I mean, from online, offline, or from radio to social networks are drawn. Okay, so I think that came back to the framework we're talking before. I think those are interest points, and I think part of the future of what we need to think goes in this multidisciplinary way, where we really need to get with us computer social scientists, AI experts, infodemic experts, I mean, public health, and really work together to design the right end-to-end, say, tools and interventions. Over to you, Tina.
Thank you, Miguel. I'm really happy to hear, because what you're describing, at least how I understand it, is really an approach to implementation, driving all of the decisions and all of the building blocks really towards a scalable, implementable infrastructure and activities. I mean, that's great. I'm a really big fan of your team. So it's going to be really interesting to also hear updates from all of the things that you've outlined going forward on this. Chris, do you have any reflections or any burning questions?
A quick thought. I'm really excited about the work, Miguel, that you're leading here in this space. And one of the challenges that's come up through the conference as well is trying to move social listening beyond the monitoring phase, where we're just picking up insights that feed into the response, but also to leverage it to better evaluate how the response is actually being taken up, how people are responding to the response, essentially. And so, there's a collaboration we have with UNESCO, for example, to develop radio messages, which are particularly useful for more remote or marginalized communities. And it would be really extraordinary for us to try and apply this tool as well to assess, whether those public health messages are actually going out and how they're being received. So just thinking about opportunities for us to continue to grow the collaboration here. And thank you so much for sharing about this great work. Over.
Thank you. I mean, that's really interesting, because one of the use cases, as you said, is even monitoring and evaluation of the messages that we are passing. And I guess that here is one small insight on the sort of things you pick up on the radio. And sometimes it is in the talk shows where you have people calling in, where more insights appear. Okay, and that's quite interesting. But also this opens other door, which is linked to one of the previous presentations, also on ethics. Okay, and in the fact that, I mean, these are sometimes personal information, or like information for someone which, I mean, doesn't know that is, I mean, it's a public sphere, but still might pose some risk. And I guess that here I just want to say that any of these projects that use digital social listening at scale, I mean, even if it's radio, even if it's public, I mean, we really need to do a proper risk, harms, and benefits assessment. I mean, for us, I think it's critical. Try to understand what can go wrong, intended and unintended, and not just at the beginning of the project, but during the project, right? Because sometimes there are sensitivities around not just individual, but populations. There are sensitivities on the data. There are sensitivities, or there are problems that may happen on the algorithm per se, even on the strategic communications, how we communicate about the project. So just, I mean, for us, it's really important to go through all these dimensions and make sure that we are like doing this in a responsible way, and we are leveraging these tools in a responsible way, like really mitigating all possible risks. Over.
Yes, thank you, Miguel. Yeah, you're very modest of mentioning Global Pulse actually has a really nice risk, harms, and benefits assessment tool that came out of the ethics and data governance work, and we used it also for several years ago for a variety of big data health projects that we were working. So I recommend everyone to check that out as well. Going forward. Miguel, What are your thoughts?
Yeah, I mean, I was thinking at two scales. I guess that on my recommendations on the one very practical applications, I mean, going to operational impact, I think it's time, as I was saying, for more projects that include public health, behavioral science, and computational science. So I guess that these three pillars can have an end-to-end use cases where we go from, I mean, understanding really the data collection to the impact. At the other level, I agree with my colleagues. I mean, regulation is coming. It's coming not particularly from the medical sector, but it's coming from other places. I mean, the European Union just launched the first proposal for regulation on artificial intelligence. That's going to impact, I mean, regulation around medical science. The US is getting another one. I think it's important from each one from our places to try to influence those regulations so there is not a huge fragmentation. Something that happened previously around privacy, and I do think, I mean, right now at the global scale, we are still trying to amend a very fragmented space around what is privacy or the rights of privacy of citizens. So I think now is the moment where all these regulations around AI are happening, and either from the social media platforms perspective or from other fields, all these are going to touch, I mean, the infodemic sector.
Yes, totally agree. Thank you, Miguel.